Today we will be covering Chapter 9, Loss and Grief in Old Age. The learning objectives for this chapter include differentiate the types of losses that older adults may experience and list common non-death related losses in old age. Explain how the death of a loved one affects the well-being of older adults. Identify different end-of-care life options and discuss palliative care, hospice, and right-to-die legislation. This chapter will focus on the variety of losses that older adults may face in later years, and the grief and coping mechanisms that come with these losses. Losses are not just due to death. Older adults may face losses when they retire from their job, move into a senior living facility, or get diagnosed with an illness. Just because loss is more common in older adults' life does not mean it's any less challenging to deal with. In fact, older adults can face a cumulative impact of loss because they are dealing with so much in a short period of time. This is called bereavement overload, dealing with multiple losses close together. This can negatively impact physical and psychosocial health, including a higher risk for depression. Grief is the normal psychological, social, and physical reaction to loss. Grief is experienced through feelings, thoughts, attitudes, and behavior. And feelings might include fear, numbness, guilt, anger, rage, overwhelming, sadness, loneliness, but it can also include things like strength, pride, coping, and laughter. Grief can also impact health and physiological changes in older adults. So before we dive into thinking about death and dying, let's talk about some of the other losses that older adults may face. So many older adults are faced with the need to relocate to a new living situation. Often this means moving out of their place that they've called home for many, many years to move into a retirement facility or move in with their adult children. Other than missing their independence and their home, they also might have a hard time feeling dependent on others or feeling like a burden to others, which can be challenging. And often, having to relocate is piled on top of other losses, such as chronic illness, reduced income, or losing their spouse or partner. These are often reasons for relocating. So other than the actual relocation, you're dealing with that loss as well. And while retirement is exciting for some people and something they've been planning for a really long time, it might also come with feelings of sadness or, dealing with the change of going from working to not working. And it also might be, again, piled on to other losses occurring at the same time, such as the demands of caregiving or being diagnosed with an illness that's requiring one to retire. Additionally, because of Western values that these older adults grew up with, they might feel a lack of purpose when they aren't working, or that it takes a hit to their identity and self-esteem when they are not working. And then caregiving for a partner with an illness or caregiving for yourself being diagnosed with an illness comes with losses as well. So caring for a partner, you might grieve the person that you knew as they change with the illness, especially if it's like a case of dementia. But you also might lose feelings of, financial security, privacy, leisure time, a social life, things like that when dealing with caregiving. Additionally, when dealing with your own illness, all of those things might also be losses in being diagnosed, but also the loss of your own health, your own dependence, self-esteem, and social life when dealing with illness. Okay, so moving into death and dying. As you can imagine, the death of a partner can be particularly challenging because it includes multiple losses. This might mean you are losing your best friend, your lover, your confidant all at once. Additionally, you have a lot of rituals and traditions that you've built with that person, and this all makes up a really large part of your identity as a person. This loss may represent the loss of your shared past and your planned future together, as well as the loss of your collective social support, such as friends or family that you shared as a couple. Both men and women say that they struggle with lack of physical and emotional intimacy, loneliness, and managing practical tasks of daily life after the death of their loved one. As one woman said, my husband is just the person I need to help me get through his death. So feeling like that is the person that you know the best and knows you best, and actually that would be the person who would help you the most through the situation, can be challenging. Also, the loss of a partner can have a cascading effect. This can bring back sadness of previous losses and trigger more physical health issues. Older widowed persons are more likely to die within 6 months of the loss of their partner because of the hormonal responses in dealing with the grief and the stress. And men struggle with widowhood more than women, with higher rates of physical health issues, feelings of loneliness, and self-identity.
Here's what I found.
However, over time, those that are dealing with losing their partner, most of them show resilience. They often feel pride in overcoming the challenges and learning to take on new roles and learning to find a new identity. And they often feel pride in new accomplishments. They build strong relationships with families, friends, and other social networks to compensate for the loss. Death of siblings is an important category to consider, as siblings may represent the family bond that lasts a lifetime. Most older adults will not experience a sibling death until they are over 70 years old. When a sibling passes, it is not only the physical loss, but the loss of shared family memories and stories. This can also be a reminder of mortality and cause older adults to consider a realignment of their responsibilities within the remaining family structure. Those facing a sibling death often feel they receive limited support for their grief, as most turn their attention to the bereaved immediate partner and children. This is research done by one of my professors when I was a graduate student at Purdue. He found that death of siblings was directly related to greater fear of death and depression in older adults. This was likely due to the close relationship you can have with your siblings. This is often the longest relationships you'll have with someone, and the way that siblings represent the last of your family unit after your parents pass away. They are often close to you in age, and so that this reminds you that your death might be coming soon and causes maybe this death anxiety. Death of friends is an important category to consider as well, in many of the same ways as the death of a sibling. These deaths represent losing a shared past and one that you cannot get back with someone else. As one ages, they see an increased number of friend deaths. Women express more grief than men. Older women are nearly twice as likely to report feeling lonely following a bereavement as men. Women are more likely to cope by talking with friends about grief, seek formal support for grief, and make time to remember who they lost. Similar to sibling deaths, grief about losing a friend often receives less support. Now, while older adults are processing the losses associated with grieving the death of partners, siblings, friends, or others around them, they're also coping with considerations about their own death and the dying process. Previously, the time we spent close to death was a very short time, as most deaths were due to infectious diseases or catastrophes that came on suddenly. However, now, most deaths are due to chronic illnesses that older adults live with for many, many years before death, often living beyond when they may have naturally died in the past because of scientific advances. While 90% of Americans report wanting to die peacefully at home in no pain, that is not the reality of death in our country. Approximately 60% of deaths occur in the hospital, where life-prolonging treatment is common. This is because we do not often wish to discuss or plan for death. Older adults are more accepting of death compared to younger adults for a variety of reasons, such as feeling as though it is inevitable. While they may accept death as inevitable, there is still a high desire for a good death. This includes respectful affirmation of their identity and value in life, as well as actively including them in the decision-making processes occurring around their death. The Institute of Medicine has a number of recommendations you can read about in the textbook about how to ensure a good death for patients, including looking at things like respect, dignity, control, access to information, having minimal suffering, access to comfort care, and time to say goodbye. Now, you've likely all heard of the 5 stages of grief. There are a number of models or theories about how we as humans move through the grieving process. This is the most popular model, the Kubler-Ross grief cycle. It moves from denial to anger to bargaining, then through depression to acceptance. This model is not always linear. People may cycle back through earlier stages or skip stages altogether. However, there are many other models. This one is Rando's 6 processes of mourning. This includes 6 processes one should accomplish throughout mourning. The use of the word process indicates that this is an active and ongoing reaction to loss. First, one should recognize and acknowledge the loss and react to the separation by allowing feelings of pain and sadness. Then one can recollect and remember their relationship with the loved one while working to relinquish attachments to the person they lost. Finally, they work to readjust to the new world without their loved one and reinvest their time and energy into new relationships, goals, and more. There are additional models you can explore as well. These are just 2 examples. Now, as we're thinking about death and the dying process, it's more than just thinking about what you are interested in having happen at your funeral or if you want to be buried or cremated. You have to really think about the actual dying process. And it can be a process, as mentioned, that is a little bit more drawn out than it was in the past. So a big category that's important to think about in end-of-life care is the need for palliative or hospice care should the need arise. So palliative care is for all ages with life-limiting illness. This care focuses on pain and symptoms addressed with emotional, social, spiritual needs surrounding the illness. And again, this can happen at any stage of disease, can happen while you're also undergoing curative treatment for a disease, and can happen in a hospital. Whereas hospice care is similar to palliative care, but it's often used within the last 6 months of life and focuses on comfort rather than life-saving measures. This focuses on dying with dignity and familiar surroundings. This, like I said, is often occurring in the last 6 months of life and is often the point of hospice care is that it's to be used when you are not seeking curative treatment. So this is not part of a life-saving treatment protocol. This is kind of when you're accepting of death. You're just trying to remain comfortable for the rest of your life. And this can happen in a hospital, but it can also happen in the home. So as you can see, hospice care is really a subsection within the greater topic of palliative care. Now, an important consideration when thinking about end-of-life care is how different cultures may have different views on end-of-life care. For example, some racial and ethnic groups, such as African American, Latino, or Asians, may want more aggressive life-saving treatments. Additionally, other cultures may prefer more family involvement and education about illness and making decisions about illness. After research on the subject, some suggested questions are included for doctors to use when working with patients to ensure they are being culturally aware. These are in the orange box included on this slide. So for example, instead of assuming patients want to know all the information, they may ask, quote, "Some people want to know everything about their medical condition and others do not. What is your preference?" Additionally, the doctor can ask about patient preferences for family involvement, such as, would you like to make decisions or would you prefer someone else make them for you? Or they can even directly ask the patient if they feel comfortable discussing their illness or their illness with a doctor of a different cultural background. So, like the bottom question says, sometimes people are uncomfortable discussing these issues with a doctor who's of a different race or cultural background. Are you comfortable with me treating you? Please let me know if there's anything about your background that would be helpful for me to know when working with you or your family. So this is important because some racial and ethnic minority groups and people with disabilities have a mistrust in the healthcare system and their providers. And there are valid reasons for this mistrust, including long-standing healthcare disparities, unequal access to curative or life-extending treatments for marginalized groups. For example, African American and Latinos are underserved by palliative care and hospice. Okay, so another topic that's important to consider when thinking about death and dying is issues surrounding choosing death and other right to die arguments. The Dying Person's Bill of Rights states that individuals have a right to personal dignity and privacy, informed participation, respectful service, and competent care in the dying process. Once you introduce this idea of euthanasia or choosing to end one's life, the argument becomes more nuanced and divided. See your textbook for all the different terms and arguments surrounding right to die, euthanasia, hastened death, and physician-assisted suicide. The textbook provides a lot of great examples and kind of walks through all the different things that have happened in history regarding this topic. There's also a video on Beachboard about the Terri Schiavo case that will provide some insight and personal look at understanding the importance of right to die and euthanasia. This case caused all of America to really stop and think about death and dying and what role the government takes in this decision. This case encouraged many Americans to complete advance directives. So I encourage you to take some time to learn more about this case if you haven't heard of it, because I think it's a very interesting example of the importance of having thoughts about what you want in the end of life kind of laid out for your family. And because of the Terri Schiavo case, among others, states are now implementing laws that allow patients to make decisions about ending their lives in very particular situations. Many of these laws would apply to terminally ill people who doctors say have less than 6 months to live. A patient would have to make 3 requests, both oral and written, to end his or her life, with waiting periods and the ability to rescind the request at any time. Additionally, many of these states require a mental health examination as well. So, while planning for death and dying, many individuals choose to create legal documents that share their preferences for care and medical decisions. And again, this links back to the Terri Schiavo case. If she had had a medical advance directive laying out what her wishes were, the very long and drawn-out battle to decide what to do in her case would not have happened. So and she was rather young, so it shows the importance of having an advance directive at any point in your life. There are many different forms of legally binding documents that share one's preferences for death and dying, and some of the names are listed here. While some focus on biological medical decisions, such as a DNR or a do not resuscitate order, others focus on decisions about property or assets upon death, like, a will, just a traditional will. And others focus more on personal preferences for care and treatment and social support with dying. And this is like the 5 Wishes document that we'll talk about. And even though advance directives have been promoted by health professionals for over 50 years, only about 1/3 of U.S. adults have them. People with chronic illnesses were only slightly more likely to have an advance directive compared to healthy individuals. But people older than age 65 were significantly more likely to complete an advance directive than younger ones. And you can see this graph here. As you age, you get more likely to complete these advance directives. Now, 5 Wishes is an everyday, easy-to-use legal advance directive written in layman's terms. It's America's most popular living will, with more than 35 million copies in circulation. What I love about 5 Wishes is that it is written in a way that makes sense, rather than a lot of legal language. It focuses on how you want to be cared for, not just the medical options you would or would not want. It's in 20+ languages and is legally valid in almost every state. It makes it really easy for anyone to have a legally binding, easily edited document for $5. You have a chance to complete this sample copy for this week's discussion. I ask that you look through the sample copy and answer the questions for your own personal benefit and then reflect on that experience. But if you'd like to have an actual legally binding version, you just need to buy the $5 copy, and you can fill it out online, you can print it out, and you could share it with your family and friends, and they could each get their own as well. Okay, so we talked about a lot of different things today. So a summary, make sure again that you're checking your chapter to really make sure you're getting all of the information. But overall, older adults face losses other than death, such as relocation, retirement, or chronic illness. Older adults are often resilient and find meaning and purpose in life despite their losses. However, these losses can negatively impact physical and mental health, and there are some gender differences in how that affects and how they cope. And the death of a spouse or partner can be devastating, but other losses, such as siblings or friends, can have a meaningful impact as well. And finally, there are numerous considerations about one's own death, including coping with grief or making end-of-life choices.